My topic today is, why do children who see 20/20 require an eye exam? Well, that's a good question. Sometimes the school nurse or the pediatrician will say, well, your child has 20/20 vision, assuming they do a screening. Most of them don't nowadays because they're so busy, but if that does happen, you may hear, well, your child sees 20/20. Does that mean they're seeing well? What 20/20 means is that each eye sees a certain size letter, a certain distance that we expect people to see. So they do see things relatively clearly. But the real question is, can they use their eyes together as a team and achieve in school and in sports and in learning? This is another factor. This has nothing to do with 20/20. And this is something that we do and treat. We diagnose and we test for eye coordination problems, because 30% of the people in America have some sort of an eye coordination problem, and out of that 30%, a good percentage of them need some sort of therapy. What would be the effects if a child does have this problem? Well, they may appear to be a slow learner. They may appear to be hyperactive. Some people are diagnosed as ADD or something similar. And these issues cannot be clarified without a thorough eye exam, and one that looks for and tests for in a doctor's office that treats eye coordination problems. Ophthalmologists, for example, do not treat eye coordination problems. Some of them do something with a pencil push-up, it's called, which has been proven to be very ineffective. But the diagnosis and treatment has always been the realm of optometry. Now, chain stores definitely don't do this. They don't spend the time to test or treat for it. So if you have a child that in any way, shape, or form has not been achieving up to your expectations, that child deserves to have a complete and thorough eye exam. And we do that type of testing and we provide treatment. One thing special about our office, we've come up with a way of using computer orthoptics to treat these problems. So if a child has one, it's not a huge expensive proposition, as you may have heard of other people having this treatment program. And it's something you can actually do at home, and we can monitor over the internet. Pretty amazing technology. Anyway, the thing I want you to remember is 20/20 does not mean your child is seeing well. And hearing that your child passed an eye test in school or the pediatrician's office does not in any way mean they don't need a thorough eye exam, the type of thing we do.